what's your name?
Molly Anderson.
Okay. And where are you from?
Seattle, Washington.
Do you have like a background in healthcare or?
Yeah, so I graduated in 2013 with a bachelor in biology and have been working in various parts of healthcare since then. Currently I'm working as a medical scribe at a GI clinic down in Kirkland, Washington.
Okay, so is most of your background in urban areas or?
Yeah, most of it's in urban areas. I do have some secondary knowledge of how rural healthcare works from my in-laws who live in northern Minnesota, but I haven't experienced it firsthand.
Okay. So how did you hear about the RIIN program?
So I heard about the RIIN program through a DO school from Yakima, Washington. I was thinking about applying there, and she said it sounded like an interesting program to do, so that's how I ended up here.
And is it mostly what you expected, or is it a surprise?
I think I was surprised about the scope of practice they had up in Skagway. It's a group of one PA and a couple nurse practitioners, and they're able to do anything from like treat your common cold, or they'll do more severe traumas if someone happens to get injured on a hike or one of the various tours up there.
So had you ever been to Alaska before?
I've not.
No? Okay. And you were in Juneau for a little while, and then up in Skagway for how long?
I was in Juneau for 2 days, and then up in Skagway for 5 days, and then back in Juneau again.
And what were you doing?
So in Juneau, the first day I was with the medevacs, and we went on a call up to Sitka, all the way down to Seattle, and then back up to Juneau to transport a patient. In Skagway, we followed around the PA, Chris, and some of the nurse practitioners around his clinic from Friday until Tuesday. Came back down on Tuesday, and then Wednesday I was with the same-day surgery at Bartlett Hospital, watching some colonoscopies and EGDs. And then Thursday was probably one of my favorite days. Spent the whole day with the Capital City Fire Station. Went on one call, and then the rest of the time it was like family time.
Nice. So Skagway is kind of an interesting case. It's a small town, but it's a big tourist town, so there's a lot of cruise ships that come in. So you're going to be dealing with a lot of people who are not actually from the community. Is that a challenge, or does that make things easier?
I think it creates a very interesting problem for them. The population sits around 700, but can get as low as 300 in the winter. And then in April, they get this influx of guides and shop owners, and then all of a sudden all the tourists come, so it can get up to thousands and thousands of people. And with more people creates more injuries, and the tours around there, they're mountain hiking and biking, and there's a train ride, so there's lots of opportunities for people to get hurt. And I think the clinic has to kind of modify their practice in order to meet the needs of a large population. And they don't really have, their facility can't grow with that, so they have very busy schedules during the summer.
So what kind of facilities do they have available?
So they have like a normal family practice clinic. They have multiple ER trauma rooms. So if they can't get a patient out by medevac, they are able to take care of them, keep them stable until they can get them out. They have a dental room. A dentist comes, I think, quarterly, as well as an ophthalmologist and an audiologist. And they also have 2 behavioral health staff on board, and they can do, they have their own pharmacy, which is kind of a unique thing for a clinic. So you don't have to go and go out of town to get your medicine.
Did you get to do anything outside the clinic while you were there?
I did. We had a weekend off. The first day we kind of just spent walking around town, seeing what it was like. We learned a bit about the gold rush. And on Sunday we ended up hiking the Chiltook Trail and then rafted down the Tayo River, which was pretty awesome.
You saw some whales at some point, I think you said.
I did. Our first day in Juneau, we hopped off the plane and hopped on a boat and went out and we saw 13 humpback whales, and they did this really rare behavior that's called bubble netting, where they create these bubbles and they scream and they disorient the fish, and then all of a sudden the fish rise to the top of the water and they're able to eat them.
Okay.
Yeah.
That's unusual.
Yeah.
So is this something you could see yourself doing long-term, rural practice?
I think so. I was really surprised at how much they're able to do and accomplish with limited resources. I think even down in Washington, there's quite a need for rural health care, so I'll probably try and incorporate that down there.
Did they have any suggestions for you, things that you should know about before you get into the field?
They talked about getting more experience in rural areas and seeing if the lifestyle outside of the job was something that I wanted to do, because going into medicine, you have to love your job, but you also have to love the area you live in. And I think that was something I noticed about Chris and his team up in Skagway. They really loved the area and they love the people, and that's why they stay. And I think that's why they provide such great care.
Okay. Do you have any recommendations or suggestions for future RIIN students who might be going there? Things you need to bring with you?
If you go to Skagway, there's not a whole lot of native culture, but there's a lot of stuff to do. If you're really outdoorsy, it's a good place. There's all sorts of rafting. You can do ice climbing. We didn't do any of that, but I think you can go out and meet a lot of interesting people. There's cruise ships coming in almost every day. We met some people from Tennessee, all across the U.S., some people from out of the country. I would bring some food. The grocery store, the barge didn't come on time, and so there was probably one orange left in the entire produce section, and a lot of the restaurants will actually close down because they don't have food.
That's something that doesn't happen in Seattle.
No,
routinely.
no, we don't have to wait for a barge for food.
Okay, any last words?
I'm really happy that I did this program. It kind of pushed me out of my comfort zone. I got to see a lot of different sides of healthcare. I didn't know there were medevacs. I didn't know the workings of a fire station. And I'm really glad I got to go up to that clinic and see what they were doing.
Okay. Great. Well, thank you for talking to us.
Thank
Appreciate
you.
it.